Hey everybody, it is Dr. Liz from Helendale Dermatology, and today I'm going to talk about acne. During the summer months, a lot of us sort of take a break from everything. We give up on our skincare routine, but a lot of times acne will actually flare during the summer. Yes, sunshine will help breakouts, but we obviously don't recommend that, especially if there is active scarring, because the sun will actually make those scars worse in the long run of their life. And I always say I'd rather treat a wrinkle than an acne scar all day long because they are tough to treat. We do have lots of treatments for them, but we want to get rid of the acne before we make scarring. So the boutique actually has many different things. One, going back, what causes acne? Why does some person get it and why another person does it? Basically, some people, their cells are kind of sticky. They're epidermal cells, and when they sort of die and they're supposed to fall off, they actually sort of stick together and then make what we call a microcomedone. That microcomedone can then go and develop into a regular blackhead or comedone, an open comedone, a closed comedone, which is a white head, a papule, which is just sort of a red bump, a pustule is a red bump with a sort of pus head on it, and then lastly a cyst. Cysts will make scars all on their own. They don't need to be poked or squeezed or anything else like that to destroy those collagen and elastic fibers underneath the skin. So back to my statement. The boutique has a ton of different things to use for acne that don't even require a dermatology appointment. I have some of them here today. We always want someone with acne to go and be on a great cleansing routine. A lot of kids, even though that they may seem oily, they may actually need a light moisturizer, and certainly they always need sun protection. Adults typically do need a moisturizer because they're not oily, so a nice cleansing and moisturizing routine is really the basis which everything starts with. It's been interesting over the years. I've done a ton of acne clinical trials, and even kids on placebo, they get better, all right, mainly because they're actually keeping a dry diary that they're cleansing and moisturizing twice a day. So that is really super important. So what do we try to get acne patients on? Often some sort of what we call retinoid, all right? And retinoids and glycolics, and these are two examples of glycolic acid, all right, they really kind of do the same thing, although I have sort of a little partial affection for glycolic acid because I think it works better and it's much more easily tolerated. What do retinoids like Differin, tretinoin, the triacnyl night, what do those things do along with the glycolic acid? They make our cells less sticky, all right? So that's really working on the first stage of the acne process. They actually both also help with scarring, so we really do try to incorporate something like this into a basic acne regimen. Other things that we do is topical antibiotics. The bacteria sort of play a later role in everything. I personally am not a huge benzoyl peroxide fan. I've had way too many towels ruined by my wonderful nieces over the years. And so I don't want to be that doctor who ruins some mom's towels or carpet or something else like that, because benzoyl peroxide will bleach things out, all right? If you have a careful teenager or if you're an adult and you're careful, you put it on, you have to wash your hands before you grab that hand towel because otherwise you will leave bleach marks there, all right? So we use topical antibiotics. We use topical benzoyl peroxide, that kills bacteria. Some people, believe it or not, can be allergic to the benzoyl peroxide molecule. And I always tell patients is the higher the strength of benzoyl peroxide does not actually mean better. What it's gonna mean potentially is more irritation. So, if you are gonna just try some good old over-the-counter benzoyl peroxide and your over-the-counter agents short of Differin are really benzoyl peroxide and salicylic acid. Both of those will dry out the skin, and less is more with both of them. You don't need to get the super duper strength. It's going to work just as well as the lowest strength, okay? And if benzoyl peroxide and salicylic acid don't work for you, Don't keep buying different brands of it because they're not going to work for you then, okay? Other things that we use something called topical dapsone. It's classified as a topical antibiotic, but in theory, it really kind of sort of slows down our inflammatory cells. So instead of making a big red bump, we're going to have a smaller red bump, or hopefully no red bump at all. We have here manufactured for us is a topical spironolactone. Spironolactone is a diuretic or water pill, and what it does is it sits on our testosterone receptors. So obviously we don't give it to guys, but what it does is it sits on that receptor and makes our circulating testosterone in the skin work not as well. So we often prescribe that. We can do that in a topical form that actually doesn't really exist at the pharmacy. In 2021, we started working with a company in Florida. They work directly with the FDA to come up with very mild and very clean ingredients. So they've taken out a ton of preservatives. They've put things in them like topical niacinamide, and just some of them even have topical antihistamines in them to really go and sort of decrease that amount of inflammatory response. So we do that. We can use sometimes supplements, all right? Right now, we're all really loving the Nutrafol Skin. That we've had great success with Nutrafol Hair, and they launched their Nutrafol Skin probably maybe about 4 months ago or so. We got early access to it and gave it to patients, gave it to staff, and we're just so impressed about how that works, all right? We also have something called Acumax from Jane Iredale. That's sort of like the plant version, the sort of milder, more natural version of Accutane. We have, I think, better luck with that in boys than girls, but we really, both of those two supplements do a great job. Often I will also recommend some evening primrose oil, which is over the counter, to help with that inflammatory response. So you can come into the boutique and Michelina can go and sort of, hook you up with different things. One product that's fantastic is this Aven Clenance, all right? We say Clenance because it's French. And what is in here is actually a free fatty acid that goes and the bacteria on our skin eat and then implode. So it destroys the bacteria, the excessive bacteria doing that. And what's nice about the Clenance versus topical antibiotics is it actually helps restore that normal microbiome of the skin, which sadly gets extremely disrupted with acne treatments. Another thing about acne treatments, you don't have to be dry, red, and raw for your acne products to actually work, all right? So that is a sort of thing that we used to tell people 30, 40 years ago, is that we gotta dry you out, we gotta make you irritated. We don't have to do that in 2024. But Clenance also would have then found years ago in their spring water, and I will say that this got me through my pregnancy with my daughter that I was breaking out horribly. And what the spring water has in it is not only the precise mineral count year after year after year, it actually has a non-harmful bacteria in there that goes and helps reestablish that microbiome. So this is great as a de-stressor, okay? But more importantly, it's great if you have acne, if you have rosacea, psoriasis, eczema, that you can mist this on, and it actually has that mineral water plus that bacterium, which is reestablishing that normal microbiome, which we know, just like your gut, it's so important to the way our skin behaves. All right, so these are some of the cleansers. I love this cleanser for adults and for teenagers. And then most importantly, sunblock, all right? We really do want to protect our skin with a clean sunblock, not the chemicals. Please, if you have chemical-based sunscreens in your house, just throw them away, get rid of them. They're not good for our bodies. In 2019, they showed that after 4 days, we actually have serum blood levels of those chemicals. That really, I find kind of somewhat repulsive as a physician, all right? But just good old zinc and titanium. One, we know that zinc will help calm the skin down also, just like it's great for a diaper rash. It's great on top of acne lesions, okay? And I'll get to another product that's a nice little trick for acne. But we want those clean ingredients because we do know those chemicals tend to be hormone disruptors. They tend to be very pro-inflammatory. And really, ultimately, acne is just a lot of inflammation after those sticky cells stick together. Did I not bring it? Oh, I didn't bring in one of my favorite no. So one of our favorite products here is something called Cicolphate from Aven. And Cicolphate has zinc and copper in it, along with something called sucralfate. And if anybody has ever had a GI bleed or a GI ulcer, you know what sucralfate is. It used to be called Carafate. And it was a pill that we would give patients. I've taken it myself on and off over the years. And basically what it does is it coats the stomach, all right? It doesn't work through any inhibition of this mechanism, of that mechanism. It just literally puts a protective coat on our stomach lining. So what they found years ago is that sucralfate actually helped heal up bed sores in hospitals and nursing homes. So Aven, they combine their spring water that we know helps heal the skin. There's been studies after studies after studies that show that it does, all right? They combined the sucralfate, which helps with any sort of erosions in terms of help healing them up. And then it has that copper and zinc in there. We know that both of those molecules will act as a somewhat antibacterial side, and it's got the spring water that reestablishes that normal microbiome. So we know all those things are great for our skin. So I always tell patients, if I ask my kids to go get medicine, they would go to the drawer and pull out Cicolphate because that's kind of what they know, all right? We've used it for everything and anything in our family. Obviously, it doesn't work for high blood pressure or something else. That's just topical, but is a very magical topical. So, if you don't want to come in as a patient, and certainly, we have 5 providers here, so we can fit you in very nicely and very easily. So, but if you just want to come into the boutique, certainly Michelina or anyone else in there can help with you pick products that will be right for your acne. So, guys, have a great summer. Don't forget to wear your clean sunblock. And I love you guys and have a great day.